I am Edwin Williams. This is Science and Research News made simple for you. Syphilis, chlamydia, and gonorrhea are sexually transmitted infections, STIs caused by bacteria. Viral STIs are genital herpes, genital warts, and HIV/AIDS. Trichomoniasis is a parasitic STI, earlier known as venereal disease. These infections spread through sexual activities including vaginal, anal, or oral sex, where there is close contact with the male reproductive organ, penis, and female reproductive organ, vagina, or sexual activities through anus and mouth. These infect participating partners if one of them carry the bacteria, virus in case of AIDS, herpes, and genital warts. STI transmission does not show immediate signs and symptoms, which include vaginal discharge, penile discharge, ulcers on and around the genitals, around mouth, if they were also involved, and pelvic pain. Majority of men and women, especially girls and boys, observe themselves thoroughly for a week or so, and in the absence of visible signs, get become relieved. Some, out of guilt or shame, may try hearsay medicines recommended by friends, and by that time it might have reached secondary stage in the case of syphilis. In such cases, do not take risks for a very easily curable bacterial infection and manageable viral infection as HIV. Take immediate medical advice and get properly treated. Left untreated, as the visual symptoms disappear within a few days, the patient will soon reach a dangerous stage. Syphilis in men can cause blindness and nerve damage. Chlamydia and gonorrhea are more serious in women than in men and may lead to infertility. It may pass to the growing fetus in the womb and may cause miscarriage, stillbirth, brain and organ damage in infants born to those infected mothers. Health Department of San Francisco, US recommends that people at risk of sexually transmitted infection may immediately take preventive dose of antibiotics after unprotected sex, that is sex outside marriage or sex with various partners. Giving doxycycline prophylaxis or DPEP could be an inexpensive intervention, especially in areas where testing is unavailable or remain unaffordable. In contrast to other STI prevention strategies like male condom and partner notification, which rely on partner participation, DPEP would be woman controlled. Women disproportionately bear the global burden of morbidity and mortality from STI. In the study of Molina et al., antibiotic resistance, tolerance, and low adherence are not considered. Their study shows that doxypep on high-risk male homosexuals reduce the incidence of chlamydia and syphilis. But the problem is that it is bound to increase the antibiotic resistance. Dr. Jean Michael Molina of University of Paris advises people indulging in such activities to use condoms even for oral sex. Using doxypep has reduced ST 70% for chlamydia and 73% for syphilis, but no reduction was observed for gonorrhea. Taking doxypep is similar to taking antivirals before unprotected sex, even with the same single partner or spouse, to prevent HIV infection, commonly called HIV pre-ep. HIV pre-exposure prophylaxis. Taking HIV for taking HIV pre-ep reduce the risk of HIV infection from same partner sex or different partners by about 99%. But UK Health Security Agency and British Association for Sexual Health and HIV opposes the San Francisco doxypep. trial for syphilis or chlamydia for lack of antimicrobial resistance. Dr. Chris Kenyon, microbiologist at Institute of Tropical Medicine Antwerp, Belgium, opposes the doxypep trial of San Francisco as a person's exposure to doxypep would increase antibiotic resistance. Medical practitioners must see whether the benefit outweigh the involved risk. Visual signs and symptoms of STI begin about 10 to 90 days, normally after 3 weeks only. This increases the urgency of timely treatment. The visual symptoms are one or more open sores called chancres on the region that had contact with the bacteria like penis, vagina, inside mouth, or anus. It is often painless, so escapes detection and treatment as it heals within 3 to 6 weeks. Secondary syphilis starts after 6 months and exhibits rashes on most areas of skin, genitals, and mouth, loss of hair, weight loss, and swollen lymph. In latent syphilis, patient may have fatigue, weakness, and sore throat. If not properly treated, even at this stage, it will lead to a tertiary syphilis which attacks nervous system. This is known as neurosyphilis. Cardiovascular syphilis is the condition when syphilis becomes attacks the heart and blood vessels. Sores develop on the skin surface, lungs, liver, bones, etc. Stages of syphilis: burning or itching on reproductive organs or mouth, unusual, milky or bad smelling discharge from penis or vagina, sores inside mouth, anal area, bleeding with intercourse, burning or bleeding with urination, and fever. If any of the above symptoms are noticed after sexual acts, especially after an intercourse or infection is feared, contact a physician immediately. STI caused by bacteria, parasites, etc. are easily curable with immediate proper treatment. For HIV, HPV, etc., there are which are viral in origin, there are no immediate cure available, but there are medicines that will diminish their effects. Research works are in progress to find permanent cure for them also. According to 215 estimation, there are about 1.1 billion people around the world with STI other than HIV AIDS. About 500 million were infected either with syphilis or gonorrhea or chlamydia or even trichomoniasis. 530 million have genital herpes. 290 million women have human papilloma virus. ST other than HIV resulted in 108,000 deaths. In US alone, there are 19 million new cases of STI in 215. Gross reference Nature's Volume 612, 20 to 21 pages of 2022. Molina J.M. et al. Lancet Infectious Disease 18, 308 to 317 pages of 218.